Going to get into it today and decide what it is and can you afford it and do you want it. Dr. Peter Capizzi is here. How are you, sir?
I'm fine. Thank you. Thanks for having us.
Yeah, thank you for coming in. And Jessica Irby, thank you so much for being here.
Thank you.
We're delighted to have you here as well. Okay, so you had a mommy makeover.
Yes, I did.
We're going to ask you about that in just a second.
Okay.
But mommy makeover can be a lot of things, can it?
Oh, it can be. It can be. You know, motherhood is one of the greatest joys of life, but when diet and exercise don't get you back to your pre-baby appearance, people seek out a cosmetic procedure or consultation for a series of procedures. The Mommy Makeover can bring you back to that pre-pregnancy appearance.
Yeah, and I get kind of torn about mommy makeover sometimes because I think, well, just let it happen. I mean, you had babies, it's amazing, you did an amazing thing, but then I know so much of our self-esteem is wrapped up in how we look.
That's true,
Yeah.
and I think that's definitely true, and it's not just the procedure, it's the process, and certainly the process in our practice to help one get from point A to point B.
So you've had people do just 1 or 2 surgeries for part of a mommy makeover, and you've had someone do multiple surgeries.
Oh, absolutely, and it's more and more each and every week. Since we individualize each person, we're able to be more efficient and not increase their recovery time and do more procedures.
Well, Jessica, tell me a little bit about why you decided to do it.
Well, the biggest problem I had after having 3 children, my waist was larger than my hip size, and my pants, I would fall all the time. And so I would have to wear a belt, and sometimes it would pinch my skin because it would be so tight. So I finally just decided to have a consultation with Dr. Capizzi, and he put me on the wellness program so I could get the most out of my procedures. And he replaced the implants that I had prior when I was in my 20s. I got implants, and they would shift and slide all the time. So he explained that they had this new gummy bear implant. He gave me a lift. He gave me a tummy tuck with lipo. And now I have a waistline that I never had even before children. And I can't tell you how amazing it feels to be able to go in and just be able to buy the size pants that you need and not have to try to wear multiple layers to hide it. So I'm so happy I had it done.
Yeah, you felt better when it was done.
Yes.
Okay, let's talk about a couple of things. Let's talk about, she mentioned it, let's talk about, this is a gummy bear implant?
That's
is that
correct.
what you call it?
Yeah, it's a gummy bear implant. It's
Hey, Nick, come here.
What's called a highly cohesive silicone gel implant. It's been available on the market since 2013 in the U.S., but it's available worldwide.
So
And
instead of being filled, it is one sort of whole
it's
thing.
one solid piece. And it's kind of like mozzarella, if you want to think about it. You just cut the
Yeah.
mozzarella ball. It doesn't go anywhere.
Okay.
It's stringy like that.
And then what is this other thing you brought?
This is another, this is kind of like crazy glue in a caulking gun. And it's used for a drainless tummy tuck, or when we do the tummy tuck procedure to decrease the amount of time a drain is in. And actually seals everything.
And that's, I mean, any sort of making the recovery process easier is so important, isn't it? Because I've seen people who've had lipo, who've had augmentations or lifts, and they have staples and they're in pain, and it's a long time.
Right, and I think you know, Jessica is, you know, a great example of someone that comes in, was a good candidate, but 20 years ago we didn't have the wellness program, so she lost 30 pounds. So we turned a
amazing.
good candidate into an excellent candidate, and you can bet that that person is going to recover much easier than a person that was 30 pounds heavier.
Well, you look fantastic, so thanks for coming
my
in.
medication, I had high blood pressure medication. It was cut in half. So
Look at that.
it was win-win.
Very, very quickly, if people want to find you, how do they?
Oh, they can look at my website, capizzimd.com, or they can call me at 704-655-8988.
There you go. Thank you both for coming in. We appreciate it. I'm fascinated by this. I'm going to look at this one. Chris, you're in the social center while I check this out a little bit more.
The gummy.
Yes.
Oh, different.